Let's dispel some common myths about HIV transmission. There are many misconceptions about how HIV is spread, and it's important to understand the facts to reduce unnecessary fear and stigma. You cannot contract HIV through everyday activities that involve no exchange of bodily fluids. Touching, casual physical contact like hugging, holding hands, or shaking hands is perfectly safe. These actions do not involve the exchange of bodily fluids, which is necessary for HIV transmission. Sharing food or utensils. HIV is not spread through saliva, so sharing utensils or eating food prepared by someone with HIV is not a risk. You can enjoy meals together without any concern of contracting the virus. Using the same bathroom toilet seats, bathroom surfaces, or sharing a bathroom with someone who has HIV does not pose any risk. The virus cannot survive long outside the human body, and it is not transmitted through skin contact with surfaces. Sneezing or coughing. HIV is not an airborne virus and cannot be spread through respiratory droplets. Unlike the flu or common cold, HIV requires direct access to your bloodstream to be transmitted. Insect bites. Mosquitoes and other insects cannot transmit HIV. The virus does not survive in insects, and they do not inject blood when they bite. Remember, HIV is not as easy to contract as some may think. Understanding the actual transmission methods can help alleviate unnecessary fears and promote a more informed and compassionate approach to those living with HIV. It requires direct contact with infected bodily fluids through specific activities. These include unprotected sexual contact, sharing needles, or from mother to child during childbirth or breastfeeding. By knowing the facts, we can better protect ourselves and support those affected by HIV. While oral sex carries a lower risk of HIV transmission compared to vaginal or anal sex, it's not risk-free. The risk is higher for the partner receiving oral sex. Factors that increase the risk during oral sex include sores or bleeding gums. Open sores in the mouth can provide an entry point for the virus. Genital sores. Sores on the genitals of the partner with HIV can increase the viral load in fluids. Ejaculation in the mouth. While the risk is still lower than vaginal or anal sex, coming into contact with semen increases the chances of transmission. Using condoms or dental dams during oral sex can significantly reduce the risk of HIV and other sexually transmitted infections. Section 5, Protecting Yourself, PrEP, and You equals You. Thankfully, we have effective tools to prevent HIV transmission. PrEP, or pre-exposure prophylaxis, is a daily medication that can significantly reduce the risk of contracting HIV. It's highly effective for individuals at high risk of exposure. PEP, or post-exposure prophylaxis, is an emergency medication taken within 72 hours of potential HIV exposure. It can prevent infection if taken correctly. When someone living with HIV takes their medication consistently and achieves an undetectable viral load, they cannot transmit the virus sexually. This is known as U equals U, or undetectable equals untransmittable. U equals U is a powerful message of hope and a testament to the effectiveness of HIV treatment.